I'll be reflecting about the situation from Sudan. We are a unique country in that we have had almost 17 military coups, the largest number in Africa. We also have vast borders with 7 neighboring countries. So who are these people in humanitarian crisis? These are the refugees from nearby countries due to war or political instability. They are the asylum seekers. They are the internally displaced. They are the victims of conflict and natural disaster. The refugees in my country form about 1.1 million people, and they are coming to Sudan mainly from Chad, Eritrea, South Sudan, and Central Africa. The majority of them leave the camps, and they live in the outskirts of the main cities. The situation in the outskirts do not meet the minimum standards. The internally displaced is another group, almost 2.5 million. They are in the far west and in the new borders with South Sudan and in the southeast. And people in these yellow states need 52% of the people in the states shown in yellow are in need of humanitarian assistance. Natural disasters like flooding and fires. In Sudan, we have flooding almost every year, especially around the banks of the Nile, leaving thousands of people without shelter and without their belongings. And the photo down about the fire, this was taken yesterday in the outskirts of Haj Yusuf in Khartoum. I had a personal experience with flooding when my friend's family in 2013 were totally, the whole area was totally surrounded by water, and it was stinky water, and nobody could enter there for 7 days. We managed to arrive to them after the water went down a little, and to reach them, we had to step on the broken and fallen houses. And I remember the psychological shock that this family had. So these people have got varying needs. The internally displaced, according to the relief organizations working in the area, they mentioned that the priority of the internally displaced are livelihoods, education, and shelter, while the refugees mentioned that shelter is their main need. For people living in the camps, it is livelihoods, health, shelter, education, and water in that order. So what are the challenges affecting them in order to access health services, including palliative care? We have to understand that these people are coming from different social, cultural, and linguistic backgrounds from the people they are surrounded by, and that makes it more difficult for them to access the services. They need to travel to the health services because we have few oncology and palliative care services in the country. And these people are financially challenged. They travel for days from their original places, and all that leads to their late presentation. We also have to tackle the problem of identification because they have lost they don't have an ID, or they don't have a documentation, or even if they have a card mentioning that they are refugees or nationals of another country, in the hospital, unfortunately, they are treated as foreigners, and they pay the full price of the medicines and the service. I have 3 cases to show. The first patient is a young man from Eritrea, and he was in the refugee camps in the east of Sudan. And he presented with us with a poor general condition and a huge abdominal mass. The investigations showed that he has renal cell carcinoma with lung mets. And so I had to go into the discussion about his diagnosis and his prognosis, and where would he like to stay, considering the short lifespan he's going to have. And I made use of the relative who knows his language and my language. And after going into the middle of the chat and describing to him and explaining to him his prognosis, the relative confessed, doctor, I didn't say that. And what were you saying? And he said, no, I was just reassuring him all the time. So I had to go back and use another use another translator to help me for translating to this patient. And I checked with that translator that he translates what I want step by step, and not say what he wants. For this patient, we supplied him with 2 months supply of morphine, and he went back to his wife and children. The second patient I have seen a few days ago, this is an elderly lady with advanced stage cancer, and her symptoms have been controlled. So for us, it's better that she stays in her house or near where she wants to stay. And so I asked her, would you like to stay here in Khartoum, or would you like to go back and stay in your family house and like this? And she says, yes, I want to go back and stay in my house in the outskirts of Nahla. And then her daughter whispered to me that the house is not there anymore because the whole village has been set on fire. And this is a big challenge for us, for these patients also. The third story is a lady who had breast cancer, and she's coming from Congo, and she had the surgery in another country, and because of the war and the unstable situation, she arrived to us after 1 year from the surgery. Her treatment was compromised because, number one, she didn't do the correct surgery. The axillary clearance was not done. She didn't pursue the adjuvant chemotherapy in time. And so she came with us with a 5 centimeter axillary unresectable mass. We see a lot of patients like this with huge tumors. This was yesterday. This patient, also a refugee, presented with this huge mass with foul smelling odor. And we did the dressing. And before doing the dressing, we gave her morphine because of the pain. And we had this thin sheet of flagyl over the wound and a thin sheet of gauze so that we allow aeration. So when we are dealing with these patients, you can see that this patient's arm on the left, she had very thin. In fact, this patient had a hemoglobin of 4 grams. This is the lowest hemoglobin I have seen in a patient in my life. 4 grams per deciliter. And her teeth were almost all gone. So when we are dealing with these patients, we have to remember the trauma that they had undergone, psychological trauma, and they might be a lot of losses, not only in belongings, but in the dear lives of the people whom they love. They have their basic needs unmet, like the need for food, water. They need financial assistance. They need help in order to navigate the complicated systems that we are having in the hospitals. And they come to us like the lady we have just seen with poor nutritional status. They have neglected their comorbidities. They are not managing their diabetes, their hypertension. And most importantly, they need a place of care because home is there no more. Thank you.